The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of Inside JACC. Now, there's been a lot of excitement recently as Ticagrelor has been recently approved by the FDA as a potent antiplatelet agent. And in terms of that, we have a very interesting paper in press in JACC that deals with a comparison of Ticagrelor and clopidogrel in patients with acute coronary syndromes. And here to discuss that with me today is Dominick Angiolillo. And Dominick is Assistant Professor of Medicine, Director of Cardiovascular Research at the University of Florida in Jacksonville. So, Dominick, why don't you tell us a little bit about the nature of the study that you're reporting in JACC?
Yes. Well, the study, which is called Plato Platelet, it was a predefined sub-study of the overall major Plato trial. This was performed specifically to perform pharmacodynamic assessments, in other words, platelet function analysis, in patients, in a subgroup of patients enrolled in the trial. These were patients that were recruited both in the United States at our center, University of Florida, as well as in the UK at the University of Sheffield with Robert Story. And we conducted this study looking at patients in both the acute phase of treatment as well as the maintenance phase of treatment. So this was the whole objective of the study, to understand precisely the pharmacodynamic differences between the two drugs in the specific cohort of patients.
And of course, it goes without saying that the platelet trial was one of those pivotal trials that compared Ticagrelor with clopidogrel in patients with ACS and showed a reduction in endpoint events with the Ticagrelor. Now, in this study where you looked at pharmacodynamics, why don't you tell us the most important findings?
Well, the most important finding is actually somewhat confirmative to what we've seen in other settings of stable cohorts of patients, is that even in ACS patients, both in the acute phase of treatment as well as in the chronic phase of treatment, treatment with Ticagrelor is associated with greater platelet inhibition using a series of platelet function assays. We use many platelet function assays. And this leads to the concept of reducing what we call on-treatment platelet reactivity. This is a new definition that we have today, also based on the recent white paper that we published in JACC. So I think the take-home message is clearly Ticagrelor reduces on-treatment platelet reactivity, even in ACS patients, compared to standard dose clopidogrel.
Now, I think you also looked at the effect of proton pump inhibitors in these patients as well, and some question about whether patients in the United States responded similarly to those from outside the States.
Yes, these were two additional analyses that we performed due to the interest, with regards to the first question of interaction of PPI on clopidogrel, and see if there was any impact on Ticagrelor. And basically, we did confirm the PPI clopidogrel interaction. In particular, these patients had reduced clopidogrel-induced antiplatelet effects. The same was not observed in patients treated with Ticagrelor, and this is due to the fact that Ticagrelor is not metabolized by the cytochrome P450. So this is interesting results on one half. And the other half, I'd say, even more of interest was the analysis that we did between patients enrolled in the U.S. and patients enrolled in the U.K. And the reason for doing this is that we know that with regards to the outcomes of the major trial, there were differences in the effects of Ticagrelor. Ticagrelor was not as beneficial in North Americans. And this may be related to the difference of the dose of aspirin being used on the two sides of the Atlantic Ocean. However, in this pharmacodynamic study, we did not see any differences in platelet reactivity between patients enrolled in the United States and in Europe. However, I'd like to mention that there were very few patients that were on high dose of aspirin. The vast majority were on 81 milligrams of aspirin.
Well, important findings regarding Ticagrelor and clopidogrel, and we thank you very much for being with us and bringing this important information to JACC. For Inside JACC, I'm Tony DeMaria.